Thank you for joining us for this episode of Clinical Conversations. Super excited to have a pretty passionate group joining us today to talk a little bit about advocacy. With us are three clinicians. I have Michelle Tanner here from our Georgia area, Dr. Stephen Wentz from North Carolina, and Ms. Katie Abibi up from Pennsylvania. Brought these three people in to be able to talk a little bit about advocacy and some of the current issues that we're facing. So I'm just going to get straight to it and kick us off here. Can you guys speak a little bit to what advocacy means to you as a physical therapist and why this is a really essential part of our profession?
Yeah, I mean, I think that advocacy is incredibly important, obviously, for a lot of different reasons. But I would say the bottom line for advocacy is to make sure that our profession survives in an economy that has been very, very difficult over the last few years, especially since the COVID-19 pandemic.
Very true. Steve, anything you want to add to that?
Yeah, I think it's important to recognize that it's not just PTs that are impacted by things that have happened, but our PTA colleagues. We felt it across all of orthopedic outpatient physical therapy in particular. We've had a lot of cuts to their services, and it's impacting things greatly. So if we want to maintain not just our profession as PTs, but also ensure the future profession of PTAs, then we got to advocate and we got to do better.
You guys think of advocacy, what are the most significant barriers that you feel we as a profession are facing in becoming really effective advocates? And do you have any suggestions on how these could really be addressed?
I mean, I can definitely speak up here. I mean, even from the beginning of my career as a doctor of physical therapy, I didn't really have a role model that I got to watch that was passionate about advocacy for our profession. So it wasn't something that I thought was very important. And then I've been with Upstream, our company, for a long time, ever since I graduated. And I've watched them grow stronger in that area. So it's been something that I've become more passionate about, but I think it can be affected by if you have a role model, if you have a company who is passionate and also has a voice for advocacy in our profession. I think it also comes down, and we're going to talk about this even more, with us being very busy with patient care. We are understaffed as a profession with physical therapists and physical therapist assistants. And so when you're very busy focusing on trying to see your patients, it's really hard to make time to be a really strong advocate. And I think that can be a barrier as well. And I think, when we collectively advocate, it benefits the profession.
Can any of you share of a time where you have been involved in advocacy efforts and really feel like you've made a meaningful impact on whether it's a patient, policy, or the profession as a whole?
Sure, I can hop in there. Recently, in the last couple of years, I've been much more involved in advocacy efforts, and I've been fortunate to do a couple trips to Washington, D.C. Both of those trips have resulted in direct contact with my congressman, and in 2 years successively, he's introduced legislation to increase reimbursement across the healthcare diaspora of clinicians in all fields. So not just for PT, but other health professions as well. But in particular, he has become an advocate for us on not just the things that he introduces, but bills from other members of Congress. And the legislation has been bipartisan. And as a result of some of those relationships, we see some changes coming up here in the next year. Things like plan of cares aren't going to need to be signed starting January 1st. The SAFE Act, which hasn't really moved forward much yet, but will ensure that every patient that goes for a yearly screening that's over 65 and on Medicare is also seeing a physical therapist for a balance screening. So I think by getting in front of those members of Congress and sitting down with them face to face, it's resulting in a turnaround. It just takes time, and it takes building relationships.
Absolutely. I think, Michelle, you kind of mentioned this a bit earlier, but one of the biggest challenges for advocacy, right, is we don't learn a lot about this a lot in PT school. I think there's some variability depending on maybe where you went, but a little bit of imposter syndrome, if you will. And I can even attest to that being really newly involved in advocacy. But I think this is a great platform for this group of, when we think of clinicians or students who are new to advocacy, who are thinking, I think this sounds like I want to get involved, but I don't really know how. What first steps would you all recommend that they take to really get involved and make a difference? And I want to shoot this to Katie first, because she not only is a clinician with us, but is dueling it out as an adjunct professor at Carlow University as well. And so I think she's got some really insightful experience to this.
Yeah, thanks, Misty. So I think there's a couple things to think about. I think advocacy will grow with you throughout your career. And so dipping your toes in the water of things you're comfortable with. So for me, when I reflect on my career, like at first it was just advocating for my patients and advocating to make sure they got the care they needed, making sure my community understood the services that I could bring them, making sure my physician partners understood the skill sets I brought to the table, and really advocating for myself for a place in PT in my community, right? And I think as I grew up, and as you grow as a clinician, that starts to expand when you realize things like, wait, I learned all these things in school and I don't get to use them because this system or this law or where I practice doesn't allow me to do X, Y, and Z. So then you start to advocate because you're like, well, I know how to dry needle because I practiced in Georgia for 10 years, but now I'm living in Pennsylvania and I'm not allowed to do it, right? So now I become an advocate locally of making sure that my skills are able to be used in my community and that I'm practicing at the top of my license. So it can be very, very simple and kind of, self-centered in terms of making sure I'm being represented within my profession. And then for me, kind of as I've grown up, now I'm thinking about the next generation, right? And the students that I'm teaching and the new grads that we're coming in and influencing. And it's about small wins to make sure that this profession that has given me a lot is going to give the same and more to the next group. And so things, Stephen said it really well. He was able to speak to my class this week, and he said, start with just knowing the laws, knowing what is legal and what the policy tells us, and making sure that you're advocating to work at the top of your license, and then figuring out what's not and what should be, and then attacking those. So start locally, expose yourself, make yourself uncomfortable, go to local chapter meetings, hear where there's gaps in skill sets or gaps in needs, and volunteer yourself. Be generous with your time, and just be bold. Don't be afraid to kind of go head to head and advocate for what you know is right.
Love it. Steve, I'm going to pinch the same question to you. I know that you've been involved in several different avenues and had lots of different exposure points in building where you live in advocacy today. So any avenues that you think that could be provided for students or clinicians who are interested in learning more, or I think Katie said it's good dipping their toes in the advocacy pool, if you will, that they could take advantage of?
Yeah, I think the very first thing to mention is join the APTA, stay a member of the APTA. Don't just let that fall by the wayside as you graduate and you're no longer required to be a member as your school might require you to be, or as even some companies are requiring and willing to pay a portion of your dues or all of your dues. I don't know how many people recognize, but if there's something you want pushed forward, and it requires an act of Congress, either at the state level or federal level, particularly at the federal level, if we put that forward as a charge from the House of Delegates within our profession, and we want to advocate for that globally for all of us, that is anywhere from $50,000 to $100,000 per year just to get that in front of the right people, to get them to sign on to it. And that's beyond the relationship. That's the reality of what it costs to get something done. So the first thing is always be a member, stay a member. If nothing else, your dues will support your profession in the background. Nothing happens because an individual decides that they really want to be a great dry needling practitioner, and they know they can do that, and they have that skill, and they learned it in school. If you want that ability, somebody had to go and legislate it, right? And if you aren't going to be the one that wants to do that, well, you can put your money where your mouth is effectively and support it through your APTA dues. Beyond that, get involved, APTA Engage is a fantastic way. There's plenty of options in there. And then even if you don't want responsibility roles, if you have enough on your plate as a young clinician or as a student, go sit in on some meetings. They want you there. They want you to go to the chapter meetings. They want you to go to the academy meetings. They want you to go and understand what sections are. Support what you love in your profession, and you will find that it's not just the profession that supports you, but you will then feel more engaged, and the rate of burnout in yourself will reduce because you are involved.
For those people who are ready to take that next step, they are here for it. They're ready to take those steps to help affect change. Michelle, what kind of strategies, when you think of the grassroots level, are there for PTs or OTs, any of our therapist colleagues, to influence policymakers and really help drive change? Could you speak a little bit to that?
Well, I'm a good person to speak a little bit to that because my answer is to first be a big mouth, and I'm a little bit of a big mouth. So, but I mean, for real, we need to talk about these things, right? We have we're very lucky in our profession for it to be a very social profession where we're talking with patients, our colleagues, our work families, each other. And there is one of the most important things we can do is to talk about the issues that we're facing. That's what I've been encouraging my teams and my clinicians to do is to just be vocal. And then being vocal, provide people with the resources to also be vocal, which includes sending letters to legislatures, right? So we need to send those letters. The APTA, just to piggyback off of what Stephen was saying, makes it very easy. There's a link, there's websites you can go. Anyone can sign these letters and send them to their legislators, which is extremely important. So not just the therapists, but the front office staff, also the patients, right? Communities, making sure that we bombard our legislators with these letters. So taking those steps, I think, is important. But then also, just as a clinician, right, day to day, outcomes are extremely important. I mean, if we don't have the proof in the pudding that what we do is beneficial for our communities and our patients, and that we're getting patients better, and that we're holding ourselves accountable to provide the best clinically skilled care out there, then our profession isn't going to move forward because we don't have the proof that we are necessary in our communities when we know that we are. We know that we are when we're in our clinics, but we need to be able to prove that as well. So being passionate about outcomes, collecting those outcomes, leading your teams to do that is very important. And then I think, just like I said, just being vocal about some of the things that we'll touch on later, which is burnout and losing people in our profession, valuable practitioners, because we are not getting reimbursed the way we should be.
Absolutely. One of the things I really wanted to be able to talk about today is a new bill that I'm really excited to see is coming up to vote, and that is the Medicare Patient Access and Practice Stabilization Act. So can you guys speak a little bit to what the key provisions of that act are and how this addresses the challenges that we're currently facing?
So that bill in particular is going to rate adjust us in a positive direction. So if we go back historically, we've had rate cuts for the last 5 years, despite all of the other things that have been happening. If you go back even further than that, we actually have closer to 25 years of slow reduction in reimbursement, not just for PT, but for our other health professionals. One of the things that's causing is a little bit of a first come, first eat kind of mentality, where collaboration is breaking down because everybody is trying to get as much of the pie as possible up front, because our patients' dollars are also limited, right? So when we look at what this bill aims to do, going from a net decrease to a net increase in the short term, it's a stopover answer for now, but it's going to alleviate some of the pressures, and it should help to increase our collaboration efforts as well as improve patient access ultimately. Right. It's not just about the dollars and cents that come back into us. I think that that's just the result of great care in the end. But patient access is what this really provides, and not just in the bigger city areas, but also looking out into the rural communities and also the underserved and underprivileged communities just the same. So I'm excited about it as it steamrolls forward. We now have enough support from Congress that it should go through without any problem. We have more than enough votes. We have 223 plus Congress people that have already signed in some capacity or have promised to sign, and that number is growing, and it's bipartisan, and it's a beautiful thing.
Love it. When you look at this bill, what are the economic implications for both the Medicare system and private practices, which is the world we practice in? And how do we address concerns from policymakers about what those costs might look like?
Yeah, so this is meaty, a very meaty question, Misty, but one that we definitely need to tackle. So I did a little bit of research, so I'm going to drop a little bit of data out there for you guys. But just to reiterate what Stephen had mentioned, 26% reduction over the past 2 decades, never receiving an inflationary update. It's really maddening what is happening to our profession, right? And not just us. He mentioned it. It's our physician partners as well. Not sustainable. I think at this rate, there's really 2 options that occur. So first, Steve touched on this, providers start to prioritize payers who prioritize us, right? So there are payers who maybe the reduction hasn't been quite as aggressive over the past 2 decades. They value what we do. And that means that we've got to prioritize those patients because that is how our business becomes sustainable. What that means from a Medicare perspective is less access, delayed times to access for seniors, not just for PT, for physician partners as well. And then option 2, which I think is coming down the pike really fast, is I believe that private providers will go out of network. And I think we're seeing this with a big growth in cash pay, not only PT services, but physician services. This increases the burden, economic burden, and the financial burden on our beneficiaries. And then ultimately will lead to increasing morbidity for our seniors and vulnerable populations. I think we can all agree, and I know there's a lot of data out there that tells us the economic burden of a sicker, less mobile generation is a far greater impact on the Medicare system than investing 2%, 1.5% on preventative care. And I think that if you look at it from a large picture perspective, anyone that serves Medicare beneficiaries has seen the margin of our business consistently decrease incredibly, especially over the last 5 years, but obviously over the last 2 decades as well. So what does that mean for us as providers? Well, I think you see it. It means increased productivity standards, a huge focus on efficiency, optimizing every opportunity to capture every unit, right? We hear it all the time. And then in turn, from an organizational perspective, it makes it really challenging for us to pour back into our workforce through formalized things, training, development, pay increases, bonus programs, augmentation to benefit packages, and then also the informal ways. Michelle talked about, the social PTs, but things like team lunches, holiday parties, associate engagement activities, in-person meetings and connections. It takes some of that fun and connection out of what we do and who we do it with. So if I take a step back and I look at just Upstream, right, and the way that we've had to handle it from our perspective, we recognize our associates don't live in a bubble, right? We are affected by inflation. We feel stretched. We feel burned. So the company's worked really hard to kind of adjust and do it in a fiscally responsible way. I did a little research, ran this by our ops team and our HR team. In 2022 and 2023, on average, we were able to give the average front office associate a base rate increase of 10% each year. And that workforce will come in with another 6% base rate increase this year. I think we can all agree there's still room to grow. We still have room to get our front office partners to where they need to be. So to add on to that, we've added more pay for performance incentives that allows the organization to capitalize on some opportunities, restore some of our margin while also sharing in that margin with the associates. On the clinical side, obviously, we're all clinicians, so that's important to us as well. We've seen an average increase in staff clinician salaries by about 5.5% in 2023, and the average clinic director's base salary by about 4.7%. In 2023. And then these roles also have seen adjustments to the incentive programs. Again, pay for performance. We've made some of the incentive programs more attainable and more lucrative based on a variety of performance metrics. So it is important for us as an organization to try to navigate within the environment that we're operating. But we have to understand, I think it's important for us as clinicians and, associates of Upstream to understand the environment that we're trying to navigate in, right? So this bill has an opportunity for us. I think it gives us breathing room. I think it allows us to widen the guardrails a little bit in operations. We're going to continue to push to pay for performance. When you work hard, you should get reimbursed for it. I think that's what this bill says to us, right? We've been working hard. We've been serving this population. We should get paid for it. And I think we need to continue down that pathway. It's a good thing. The bill will allow us to return to a lot of our cultural things that we miss, right? The teamwork, the collaboration, the travel, celebrating successes in ways that are meaningful for our associates. And more importantly, probably most importantly, the ability to serve this population with less pressure, fewer restrictions, and a little bit more joy.
I love it. I think there's going to be, pending this passes, so many more opportunities to serve people that are in some of those underserved areas, more rural areas, and take a lot of, not just an Upstream thing, but all private practices, especially, but even our hospital systems too, and provide access to the populations that are already there being served, which is a huge advantage. On that note, we talk about wanting to get this bill passed, and we have some high confidence that might occur, but what do you guys think are the most effective ways for physical therapists, students, or other healthcare professionals, and even our other stakeholders? I think Michelle spoke to that really well, to advocate for the passage of this bill. Like, what can we do today?
I think other than just to kind of add to what I said about talking, being vocal about it, posting things in your clinic about so that patients are able to go on and to submit letters to legislators, things like that, so that we are contacting them and sending that letter through the APTA Advocacy Take Action page, and urging them to fix the flawed Medicare fee schedule by co-sponsoring this bill. But the other thing that we can do is to use the power of social media, right? Sharing that link so that your reach is expanding, not to just who you're talking to in your clinic, but to friends and to family, to other colleagues, and just making sure that we're doing that on platforms like LinkedIn, platforms, of course, like Facebook, Instagram, things like that. I think that's another really easy way to get the word out there and say, we don't need to be quiet. We need to keep speaking up.
So are there any obstacles we're anticipating this bill might likely have to face in Congress? And specific to physical therapy, how can the PT community help to overcome those?
So one of the big barriers we're going to see come up potentially is because it is an expense line for CMS, and physical therapy is often the low-hanging fruit, easiest to cut services to. So in order to keep the foot on the pedal here, in order to keep progressing forward, we really do need average everyday physical therapists and citizens, not just the big lobbyist firms and everything else, reaching out and making contact. Like Michelle has said, using those letters the APTA sets up for you, and making those contacts is a great way to start. Look your congressperson up on the US Gov website, get to know who their office staff is, and start there. And through subtle introductions, multiple attempts at just saying hi and thanking them for their service to the country, regardless of which side of the aisle they're on, is a big step forward. And then you'll find a way into your congressman or congresswoman's office, even if it remains in email alone. And remember, the value is for all of healthcare, not just the physical therapy world, but as physical therapists, there's 330,000 of us in the country practicing. So our voice is much bigger than what you might think.
Steve, on that note of recognizing like our voice and being a big voice, but that this bill doesn't just impact physical therapists, it's all other healthcare providers, right? Like this is bigger than us as physical therapists. Are there any other tips or tricks or thoughts that you would put out there on how we can collaborate with our other healthcare provider partners or other professional organizations to help strengthen the support as we're nearing that voting time?
I mean, bigger than any one individual. Again, this comes down to being a participant in the APTA. We do regularly have at higher levels association intermingling between us and the AMA, between us and Occupational Therapy Association, between us and associations that represent nurses and hospital systems for that matter. So we have collective power that can be not just for us, but really for patient access again. So if we're looking at how to do and how to be in those spaces, you just become a member. I know I keep saying that, but that is the easiest thing for any one person to do. If you're not good at writing, don't like talking, not going to go to Capitol Hill, don't want to be a section leader, life is crazy and you have 3 kids that are all under 5. If you don't have that bandwidth, the least and the easiest thing to do is to be a participant, even if it's a passive participant.
How do you feel like advocacy can really help shape the future of physical therapy, particularly when we look at scope of practice issues, reimbursement challenges, as well as just recognition of our profession as a whole?
Yeah, I'll jump in. I think I've spoken already about awareness, but I think just telling our truth, which is that we've had a greater percentage of therapists leave our profession in the last 3 to 5 years than we ever have. And we feel that. And they're leaving because of burnout, because of the discrepancy that is widening that exists between the workload combined with student debt, combined with the number of like the patients, right? The demand is outrunning the supply for us. And then that combined with the increasing cost of running a practice, it's just not worth it to many. And that breaks my heart as somebody who loves this profession and has for 20 years. And as we have seen as treating practitioners, they need us more than ever. Right? More and more patients they want more conservative intervention. They want to be healthier. And we are a huge, if not the answer for that. And if more of us are burned out and more are leaving the profession, then we're stretched more and more thinly to be able to provide that access and take care of our patients and our communities the way that we should be.
Steve, what kind of thoughts do you have on this as we wrap up?
Well, if anybody's ever watched or participated or given a TED Talk, you understand that the power in a TED Talk is not in the ask that comes at the end at the, that very timely 18-minute mark. The power of a TED Talk is the story that's told throughout it. So if you want to really make impact with this and drive things forward, be prepared to tell your patient stories. Those carry weight. If you talk about reimbursement, if you talk about the burnout rate, if you talk about it in the terms of finances, you are dead in the water. You have to make this real, and you have to bring it back to the humanity of it, and understanding that this is about patient access. So staying attentive to what's happening around you in the profession, and then pushing us forward. is incumbent upon anybody that believes that their skill set is valuable.
Katie, any last words from you?
I don't know. These two pretty hammered it home pretty well. I think the final prong is like from a collaborative approach, the impact we have on healthcare in general, right? You think about our physician partners, our surgeon partners. They don't do surgeries if they don't got someone to send them to on the way out the door, right? So this is way bigger than us, and I think our profession is bright. I think our academic preparation for clinical practice is excellent. I think sometimes we ourselves sell ourselves short in terms of our knowledge and our capabilities. And the more we work to practice at that top of our license and to push the envelope and to show the value that we bring to a much larger system. And I know it's not about dollars and cents. I'm with you on that, Stephen. But when we can show the economic impact of doing physical therapy and wellness really well, that does talk to people, right? And that does help us move the profession forward and move our society forward in terms of how we look at our function and our wellness.
Love it. Well, listen, guys, I really appreciate all of your input that you've brought to this call. I've learned a lot, gotten really some good thoughts that I can apply myself, and hopefully all of our listeners can as well. So I thank you all for your time, and to our audience, I look forward to seeing you all next time.